Hello everyone, welcome back to the Anatomy Lab. Today we're going to be continuing our discussion of muscles of the head, face, and neck, but this time with a focus on muscles for chewing, as in like muscles that help with moving the jaw. Now specifically, when we talk about chewing, like this is moving the lower jaw or moving the mandible. So you're going to see a lot of these muscles attached to the mandible to allow it to either elevate or depress the mandible. So first of all, a very prominent muscle on the side of the head, although a little bit obscured, you could see this muscle over here. This muscle on the side is called the temporalis muscle. This muscle, named for its location along the temporal bone, this muscle will be originating up here, but it is going to be inserting down on the mandible at the coronoid process. So inserting onto the coronoid process, it is going to help with elevating the jaw. So when this muscle contracts, it is going to lift the mandible and help with elevating the jaw. Now there's a synergist to this muscle that will help with doing the same type of action. That muscle is this muscle right here, a very prominent superficial muscle on the outside of the jaw. So this muscle that often goes either up and down or maybe a little bit diagonal, this is the masseter. So you can see the masseter attached to both the zygomatic arch as well as down here at the angle of the mandible. So attached to the zygomatic arch and then down to the bottom of the jaw. When this muscle contracts, it will also help with pulling the jaw upward, elevating it, and closing the jaw. So both of these muscles will help with closing the jaw, the temporalis, as well as the masseter. Now, although we usually talk about how, we only talk about how muscles pull in one direction, in this case we can see the other muscle that's going to be able to pull it in the opposite direction. So over here on the bottom of the jaw, this muscle that's kind of skinny, like a band-like structure, this is the digastric muscle. And there's actually two regions of the digastric muscle. There's this region, which is called the anterior belly, and then posteriorly over here, this is called the posterior belly. So anterior belly, posterior belly. And these two are going to be also moving the jaw, but in this case, helping with depressing the jaw, lowering the jaw, and opening the mouth. So the posterior belly will be attached or originating on the mastoid process of the temporal bone, but as it moves anteriorly to the anterior belly, it is going to be attached to the front and the bottom of the mandible over here. So when this muscle contracts, like being located on the bottom of the mouth, it is going to help with depressing and lowering the jaw and mandible. Now there's another muscle here that's often associated with it because of its proximity. This muscle, right underneath it, deep to the digastric muscle, this muscle is called the mylohyoid. Now, if you look closely, there is a major difference between the two, given that these fibers are going straight forward and back as an anterior and posterior, and it is going to be very skinny. These fibers are going to be going side to side, and this muscle is going to be very broad. The mylohyoid deep to the digastric is going to be helping to form the floor of the oral cavity. So if you look from this view, you can see that it helps with making the bottom of the oral cavity, inferior to the tongue and inferior to a few other muscles. This is going to be the bottom of the bottom of the chin and the floor of the oral cavity. So make sure that you distinguish between these two and kind of orient yourself based off of this. Digastric, it is going to be going straight forward and back, anterior and posterior. It is going to be a skinny band of muscle tissue that helps with depressing the jaw. The mylohyoid is going to be very broad. Its fibers are going to be going side to side, very different from the digastric, and this is going to be helping to make the floor of the oral cavity. Now, you can actually see these muscles from different views as well. Clearly you can see it from the external view, but if we look at it from other views, as in this view, you can see it relatively clearly. So this is really the same view that we saw before, but you just see it a little bit differently. But once again, you need to be able to orient yourself to what you're looking at. So this muscle right here, the skinny band that is superficial and has its fibers going anterior and posteriorly, this is the anterior belly of the digastric. And then you can see how it's going to connect to this muscle back here. That would be the posterior belly of the digastric. And then deep to the digastric, this muscle that has its fibers going like side to side, and there's also being a very broad and wide muscle, this is the mylohyoid, and it is going to be helping with forming the floor of the oral cavity. Now lastly, there's one more major view that is often a bit confusing for a lot of people, which in this case is the coronal plane or the frontal plane. So in this case, you can actually see the same muscles here, just it looks a little bit different. So here we are once again, but let's orient ourselves. So in this case, it's probably easier to find the mylohyoid first. So the mylohyoid, what direction are those fibers going? They're going side to side. So at the bottom of the oral cavity, you can see that this muscle, it has its fibers really long and going side to side. This is going to be the mylohyoid. And the mylohyoid is deep to these skinny bands of muscle, the digastric, specifically the anterior belly of the digastric. So this right here would be the anterior belly of the digastric, but also regarding the orientation of these fibers, like if you look really closely, you'll be able to see that the fibers are going like, or you can see that the fibers are really rounded. Like they're not long, but they're rounded. What that means is that like these fibers have been cut across, as in like these fibers would be coming out in order to go like anteriorly and posteriorly. So that's going to be helping with orienting yourself to this type of view where they've been cut in different directions. Mylohyoid going side to side, very broad and deep. Digastric, the anterior belly, very skinny, fibers going front and back and more superficial. Now, although this was part of the other video, let's take a look at a few more muscles while we're here. This muscle over here is the platysma. The platysma is a very skinny muscle that's going to be completely superficial to the rest of them. This would be the platysma covering like the majority of the neck muscles. This muscle making up the side of the cheek and has the fibers going front and back, this would be the buccinator muscle. So the buccinator muscle helping to make up the wall of the cheek. And then a couple of which we talked about today, right here, this muscle attached to the temporal bone, this would be the temporalis, which goes down to the mandible at the coronoid process. This muscle over here, connected to the zygomatic bone right here, which also goes down to the mandible, would be the masseter. And then this muscle that is more superficial to the masseter, and this muscle that also has the fibers going like straight back and forth, this is the zygomaticus major. So looking at these fiber directions will be crucial to being able to identify these different things, like along with their position, along with like what they move, what they're attached to, and how they're related to each other. So the zygomatic or the zygomaticus major, more superficial, and the fibers going front and back. The masseter muscle, fibers going up and down, attached to the mandible and the zygomatic bone. So be careful when you're looking at these and make sure you can identify these muscles from a variety of different views. Like any given view that was given to you on the models, make sure you can identify these muscles whenever possible. So with that said, we're about done with today's lecture. So take a look at these models, take a look at these muscles, and understand like where they're connected, how they're oriented to each other, and what their actions are. So good luck with your studying, and good work keeping up with all the material. I'll see you all later.